The silencer may be fabricated on working models taken from alginate impressions. However, it is very important to use a rigid tray. Never use a disposable plastic tray because there is insufficient support for the impression material. Always allow the impression material a full set before removing it from the patient's mouth. The optimum amount of advancement is the minimum amount required to provide relief from the symptoms of sleep apnea and snoring. The silencer allows incremental advancement of the mandible, assuring that the mandible moves forward no more than is necessary for successful treatment. The role of the silencer bite technique is to take advantage of the appliance's unique features to provide maximum flexibility and comfort for the patient. The silencer kit comes complete with the patented Gothic arch tracer. Components of the Gothic arch tracer are the upper or maxillary clutch with a threaded hole for the tracing and positioning stylus, the lower or mandibular clutch with a mandibular tracing plate, a threaded double-ended stylus. One end has a drafting lead, the other end has a spring-loaded positioning stylus. To start the bite technology process, place impression putty in the upper and lower clutch plates. Insert the clutches. Place the separating plate between the two clutches. The separating plate keeps the putty material from commingling and locking the clutches together.
Bite down.
Move the putty material around the edges of the clutches to obtain a good fit. Hold the clutches to maintain them in the midline position until the putty achieves initial set. It is important to do this because the occlusal plane is not necessarily level, which can result in the tracing area deflecting to one side.
Okay, open Randy, please.
From this point on, the separating plate will no longer be needed. Now carve away the excess putty from both clutches. To prepare for the bite registration, place a post-it note on the mandibular tracing area. The sticky end of the note should be away from the patient on the front edge. Bend the tips over the tracing area. Thread the stylus into the maxillary clutch with the drafting lead down. Place the clutches back in position. When the clutches are in position, they will be in contact in the posterior, but in front they should not contact so as not to move or interfere with the post-it note.
Forward, back, forward, back. From there go right, back to the center, to the left, back to the center, up to the left, back to the center, far back as you can go, up to the left now. That's it, you're done. Perfect. Okay. Now, what we have is a perfect Gothic arch tracing. Describe our range.
The Gothic arch tracer has diagrammed the patient's range of motion. In this case, the range of motion is 10 millimeters. Ranges of less than 7 millimeters may be a limiting factor for successful treatment. There is no restriction of movement to the sides. We have also established the patient's midline. Take 50% of the midline and make an X. Using a number 6 round burr, drill a hole through the post-it note and through the mandibular tracing plate. Write the patient's name on the post-it note and place it in his chart as a permanent record. We now have a guidance hole in the tracing plate which establishes the exact position for the silencer. Now cut out the impression putty from the heels of both clutches. Be sure to expose all the holes. Rethread the stylus with pin end down. Mix more putty and place the material in the heel ends.
We're ready to go back to the mouth.
Good.
Okay. Bottom ones goes in first. And bite firmly. Grind from side to
Make
side.
sure the putty is squeezed out to form a good bite registration. When the pin engages in the hole, tighten down the stylus. Massage the patient's cheeks. Because there is no registration material on the anterior, support the Gothic arch tracer as you remove it. This keeps the two pieces from tearing apart. The bite registration is now complete. This goes to the laboratory along with a set of impressions. When the patient's silencer comes back from the lab, it is assembled. Disassemble it using the supplied screwdriver. The screwdriver has a 1.5 millimeter hex which is not readily available. This helps deter patients from attempting to adjust the appliance themselves. Place the upper portion of the silencer. Check for fit. Place the lower portion. Check for fit. Check the bite for balance. Check with articulating paper to make sure there is good solid contact on both bite pads.
Okay. Okay.
If the contact is not correct, adjust it with acrylic burrs and repolish. If necessary, grind in the bite pads using milling paste to achieve an absolute balance.
Bite. Forward and backward.
Once you are satisfied the bite is correct, that the patient is comfortable, and that ingress and egress are easy, reassemble the hinge. Place the retention screws back into the mandibular component. Make sure they are fully tightened. When reassembled, do a final check for fit and comfort. The patient should be recalled at 2-week intervals for monitoring. The appliance is adjusted to bring the mandible forward in 2 millimeter increments until the symptoms are relieved. Here are some common problems you and your patients may encounter and some suggestions on how to deal with them. If patients complain of sore temporomandibular joints, the cause may be too much advancement. The cure for this is to move the silencer back one hole at a time. The same complaint may also be caused by unbalanced bite pads. Check the pads and mill them if required. If the patient is fighting the silencer or clenching, suggest that they take a few nights off. Also check that the bite pads are balanced. If the problem is tender anterior teeth, the silencer may be too tight. Check for undercuts and also check the clasping.